This dental phobic patient was referred to us for endodontic retreatment of tooth number 9 and root canal treatment of tooth number 10. As you can see, tooth number 9 has a porcelain crown on it, prefabricated metal post, previous root canal, short fill there. Short fills, again, don't matter as long as the canal is void of bacteria, but in this case, of course, that's not the case. As you can see, there's a periapical lucency associated with the tooth, and there was some labial swelling with tenderness to palpation. Percussion also tender. Probings 2 to 4 millimeters all around. Tooth number 10, you can see decay here approximating the pulp of the tooth. Tooth number 11, you can see decay there, but it's not large enough that the tooth will need a root canal. The patient's general dentist will take care of that. So today we went ahead and sedated this patient. Again, patient has dental phobia. Sedated this patient and did both of these treatments in one appointment. So went through the porcelain crown here and removed the prefab metal post. I used ultrasonics to do that. This was a plastic thermofill carrier, and here they are. Take a look. So that's the metal post right there, and that's the thermofill, plastic thermofill carrier. All right. So the apical diameter of this tooth was over 90. So I went ahead and placed an MTA plug. I used white MTA, left some post space for the dentist. And tooth number 10, of course, cleaned out the decay, rebuilt the missing walls, and take a look. Take a look at the post stops. Look at this. So take a look at tooth number 9 first, and you can see that's MTA. You can see the periapical lucency and infection there, and left some post space, as I said, for the general dentist. So that's MTA. And look at tooth number 10. Look at all of this anatomy that we were able to pick up in the apical couple of millimeters of the tooth. Look how many portals of exit we were able to capture here. That's another angulation of the tooth. So as you can see, everything went beautifully. I don't use all kinds of, gentle wave and laser, and I don't use any of that stuff. This is just irrigation, copious irrigation with 6% sodium hypochlorite, and of course sonic activation, and you get results like this. All right. So as I said, everything went beautifully. As you can see, patient did really well with IV sedation. IV sedation, again, is not general anesthesia. People keep commenting, this patient is under general anesthesia for a root canal. No. Please, just Google it. You can Google it before you make a comment. IV sedation. IV sedation, twilight sedation, conscious sedation, not general anesthesia. All right. But patient did really well. We went ahead and temporized both teeth and referred the patient back to his dentist for the permanent restoration.